Hello and welcome. You are watching Step Up Medicine series on cardiovascular physiology. In Episode 2 we will be covering cardiac muscle and action potentials. Inaction potentials. Let's go. By the end of this video, students should be able to describe the structure and function of cardiac muscle, differentiate between contractile and pacemaker cells, understand the phases of the fast and slow cardiac action potentials, relate these processes to heart function and ECG waveforms.
Cardiac muscle shares some features with skeletal muscle, but it's uniquely designed for constant, rhythmic contraction. Here are the key features: striated and branched fibers, 1 to 2 nuclei per cell, specialized connections called intercalated discs, which contain desmosomes for mechanical strength, gap junctions for electrical coupling. These connections allow the heart to contract as a unit, a functional syncytium, where cells work together to keep blood moving efficiently. There are two main types of cardiac cells: contractile cells, these make up about 99% of the heart and generate force. Pacemaker cells, just 1%, but they set the pace by generating action potentials. Pacemaker cells are located in the SA node, AV node, and conduction system. Contractile cells are found in the atrial and ventricular walls, and they respond to the electrical signals initiated by pacemaker cells.
Let's talk about the fast action potential, the electrical activity seen in the contractile cells of the heart. These are the cells in the atria and ventricles that actually generate force to pump blood. Zibordor. Their action potential has 5 phases, labeled 0 through 4. Bordor. Phase 0 is rapid depolarization. Sodium channels open, and sodium floods into the cell, making the membrane potential more positive. Phase 1 is a brief initial repolarization. Sodium channels close, and a small amount of potassium leaks out of the cell. Phase 2 is the plateau phase, unique to cardiac muscle. Here, calcium enters the cell through L-type calcium channels, while potassium continues to leave. This balance between calcium influx and potassium efflux creates a flat, prolonged phase. Phase 3 is repolarization. Calcium channels close, and potassium efflux dominates, bringing the membrane potential back down. Phase 4 is the resting membrane potential. It stays stable at around -90 mV until the next depolarization. The key takeaway? This long action potential, especially the plateau phase, creates a long refractory period. This prevents tetany and allows the heart time to refill between beats. Now let's look at the slow action potential, found in pacemaker cells like those in the SA node. These cells are unique because they don't stay at rest. Instead, they spontaneously depolarize, creating the rhythm that drives the heartbeat. Their action potential has 3 phases: Phase 4, Phase 0, and Phase 3. Phase 4 is spontaneous depolarization, creating the real has travel. This is where the magic happens, creating the real has travel. Sodium slowly enters the cell through special channels called funny currents, or IF channels. As the membrane becomes more positive, calcium channels begin to open, continuing the depolarization. Phase 0 is the upstroke, but instead of sodium, it's calcium that rushes in through L-type calcium channels. This causes the full depolarization of the pacemaker cell. Phase 3 is repolarization. Potassium channels open, and potassium leaves the cell, bringing the membrane potential back down to around -60 mV. Unlike contractile cells, pacemaker cells don't have a stable resting phase. As soon as one cycle ends, Phase 4 begins again, automatically. This property is called automaticity, and it's what allows the heart to beat without any external input. One final point: the steepness of Phase 4 determines how quickly these cells fire. A steeper slope means a faster heart rate.
Let's wrap it up with the key takeaways. Cardiac muscle is striated, branched, connected by intercalated discs. Contractile cells generate force and pacemaker cells generate rhythm. Fast AP has 5 phases and involves a sodium influx, leading to a calcium influx, and potassium efflux. Slow AP has a sodium influx through funny current, calcium influx, and potassium efflux. The refractory period prevents tetany. Phase 4 slope equals heart rate. Now test your knowledge with this quick question. Which of the following best explains the spontaneous depolarization seen in SA node cells during Phase 4 of the action potential? A. Rapid influx of Na through voltage-gated channels. B. Influx of Ca² via T-type and L-type calcium channels. C. Slow inward Na current through funny, IF, channels. D. Outward K current maintaining resting membrane potential. Put your answers in the comments below.
If you found this video useful, be sure to like and subscribe for more high-yield videos. In the next episode, we'll track how that electrical signal spreads through the heart, from the SA node to the Purkinje fibers. Thanks again for watching, and keep on stepping up your knowledge.